everyone. It's so great to be here. I'm Gurleen. As Mandy has mentioned, this is an interactive session, so feel free to stop me at any point with any questions, comments, experiences that you all want to share. And I think if one person has a question, then a lot of other people must have the same question as well. So no question is little, no question is too simple. So feel free to unmute and share a question and stop me at any time. I'm gonna share my slides now so that you can see my screen. So today we're going to be talking about heart disease, and I think this is a special month to be talking about heart disease. It's Heart Month, usually February, and tomorrow's actually Go Red for Women Day, which is raising awareness for heart health and heart disease in women. So I think just to start off, I think when we hear about the heart, it's important to know kind of what it does, as well as like how it impacts us in our day-to-day life. So would anyone want to share, like, what do they think about when they think about the heart in terms of heart disease? What is the first thing that comes to your mind?
Heart attack.
Heart attack? Yeah, that's definitely one of the really like the #1 causes of heart disease are heart attacks and coronary heart disease. And we'll definitely be talking about that during today's talk. And I see in the chat difficulty breathing. That's definitely a symptom that can be associated with different types of heart disease. So when I think about the heart, I think about it in terms of a house. So I think the heart is like a house, and that's a great way to think about the different parts of the heart and the different places where you can have disease. So functionally, the heart is basically a little pump. It helps pump blood to all your different organs so that they can get oxygen, they can get nutrients, and they can get all of that rich material for those different tissues of your body to grow and survive. And just like a house has different rooms, your heart has different rooms. It has different chambers. It has 4 different chambers, 2 smaller ones on the top and then 2 larger ones on the bottom. And just like a house has doors that connect the different rooms, your heart has these valves which connect one chamber to the next chamber, and they help flow blood from one to the next. And if there's a problem with it, it can affect the way your blood is flowing. And just like a heart has pipes, right? You have water and you have other things that come into your house. There's arteries, basically pipes that give blood to your heart. These pipes and these blood vessels bring oxygen, nutrients to the heart itself. And then just like a house without electricity is going to be pretty dark, not have any energy, your heart without any electricity is not going to be able to do anything. It'll just be silent. So there's an electrical system in the heart that basically tells one part to squeeze, and that tells another part to squeeze, and those electrical signals tell the heart to pump the blood forward. So thinking about kind of like a house, different things can go wrong in the house and different parts can go wrong in the heart, similar to that. So when we talk about heart disease, I know someone mentioned heart attacks, and that's a very common cause of heart disease and one of the most common causes. And I think it's important to remember that heart disease is the #1 cause of death, both in the United States as well as worldwide. And that's why we're talking about it, and that's why it's important to think about why it presents, as well as what can we do to prevent heart disease. So here I have a picture of blood vessels. So these are basically the pipes, right? The pipes of the house. If you have any problem with that, you can have a heart attack, as someone mentioned previously, and that can lead to different problems, and we'll go through kind of the signs that you can expect with heart disease and heart attacks particularly. And then the problem with the rooms, right? The chambers of the house, the muscle. If the muscle isn't squeezing properly, you're not going to get blood flow to different parts of the heart. And that heart squeezing problem is something called heart failure. And we're going to go through these 4 different categories throughout the presentation. And then the problem with the doors, right? If you don't have blood going from one part of the heart to the other part, that can cause problem. And that's problem with the valves. So those are the little things that stop blood flow between one chamber and the other chamber. And what can be the problem with that? You can have an infection. You can have it be really, really stiff, so it doesn't open. And you can imagine if it doesn't open, blood is just going to pool there, and that's going to cause a lot of different problems. Or it can be really, really leaky, and it's going backwards and not going the right direction. And then finally, the other type of heart disease is a problem with the electric panel of the house. The electricity or the electrical system of the heart. And that can be the heart is beating too fast or it's beating too slow. And both of these problems can be problematic and lead to things like cardiac arrest. So the first thing we're going to talk about, and I think the most of the talk is going to be focused on heart disease, is specifically going to focus on coronary heart disease or heart attacks. So what does everyone think about when they think about a heart attack? What are signs they think about? If you guys have experienced it or someone you know or friends or family, or you've seen it on TV, it's usually depicted a lot on different movies and TV shows, having heart attacks. What comes to mind?
They usually say that a lot of people don't survive the first heart attack. And I think that is very scary. That some things you don't necessarily get a second chance.
Yeah, I think that's definitely very scary. And you bring up a good point that there's a lot of things to treat if someone has heart disease or has a heart attack. But if the first one is so deadly or scary, it's important to also understand how to prevent it so that the first one doesn't happen in the first place as well. What are other things? I think there's stuff in the chat. People are saying difficulty breathing. Tony is saying difficulty breathing, tingling of the left arm, pain or pressure in the chest. And those are all absolutely correct symptoms that we associate with heart attacks. So I'm going to talk a little bit about what exactly is heart attack and how does it form. So heart attack is the end result of something called coronary artery disease. So these arteries are basically, as we were saying, the pipes in your house. They supply blood flow, oxygen, and nutrients to the muscle of your heart and give it energy to squeeze. And just like a pipe, if a pipe is open, it's going to be flowing well. But if there's a kink in the pipe, if there's something that's stopping it in the way, then it's not going to be able to get that blood flow or that water or whatever's in the pipe to your end location. And in these arteries of your heart, if there's narrowing of them and there's something building up, your heart muscle is going to get less oxygen. And that's what's called coronary artery disease. And this can lead to a heart attack. And as someone was mentioning, the signs of coronary artery disease include shortness of breath, feeling really tired, especially when exerting yourself, like if you're going to go pick up groceries or going upstairs or running or walking on the treadmill or walking outside your block. Those things can be signs, as well as chest pain, feeling really tired, feeling really nauseous, feeling like very fatigued. And then I think the next thing, or this is just a picture showing this pipe that's open and then the pipe that's getting a little bit of stuff built in, so less blood is going through. And you can imagine that the more stuff is in there, the harder it is for something within it or blood to flow from one side to the other side. The other thing is, why does this build up? Why is there narrowing of the heart arteries? And that's because of a buildup of cholesterol. So who here has gone to their doctor and had their cholesterol level checked or a lipid panel? Has anyone had their cholesterol level checked or kind of have heard those terms before? Yeah, what do you guys usually, what do you know about the cholesterol levels that get checked? Have you ever heard the term bad cholesterol and good cholesterol? Yeah, I see some of you nodding. You've heard about the terms bad cholesterol and good cholesterol. So when your doctor checks your lipid panel or your cholesterols, they look at different molecules, and usually the LDL is the bad cholesterol. So you want that to be low. And then the HDL is the good cholesterol. You want that to be high. And there's also something called triglycerides, which are another type of cholesterol, and these are also bad. You want these to be lower. And these are the things that affect how and why the arteries can get really narrow and make it harder for blood to flow from one area to the other. And when this happens, there's a higher risk for heart attack. So heart attack is when there's absolutely no blood flow. So the whole blood supply, the whole pipe is kinked. The pipe can't have any blood flowing from one side to the next. And that's when it's a heart attack. And it's really important to be aware of the signs of a heart attack, because more than 800,000 Americans suffer a heart attack every single year. And if you think about that, that's a heart attack every 40 seconds. So as we're speaking, every 40 seconds, this is affecting someone. And I know we mentioned some of the symptoms of a heart attack. Someone said chest pressure, tingling, shortness of breath. Any other symptoms that come to mind when you think about a heart attack?
Chest heaviness or feeling like an elephant is sitting on your chest.
Yeah, definitely. And I see someone in the chest said nausea as well. Yeah. So it's important to remember that sometimes in heart attacks, the most common things we think about are chest pain. Often people say it's like an elephant sitting on their chest, a very heavy pressure, or shortness of breath, as well as tingling or discomfort that goes down your arm or goes up your jaw or towards your back. But also some people, particularly women, as well as people with diabetes and people who are older, might not have these typical symptoms. They could just feel a little nauseous or feel like heartburn or feel like gastric reflux affecting them. They could just feel really tired or really lightheaded or dizzy. And that can also be a sign of a heart attack or heart disease. I see Sandra pointed that out in the chat that yes, it's different for women. That's a great point, Sandra. Pain in jaw and atypical symptoms might be common in women. So it's important to recognize those signs. And if you recognize any of these, to call 911, go to the emergency department and go see your doctor. Any questions so far? Any questions you have about heart attacks, coronary heart disease so far?
I have a quick question.
Yeah.
So when the arteries are clogged, would it be like all the arteries like around the heart, or would it be like one or two main ones? I'm kind of curious as to the level of like clogging that the arteries for the arteries. Yes. So would it be like mainly, because I mean, you just said that just one of them just need to be blocked and then you're going to have a heart attack because then it's passing. But was just curious as to, is it just one single, or is it the level that within them would be the same throughout? If you could talk a little bit about that.
Yeah, that's a very, very good question. And I'm going to go back to this slide where we saw the heart here. So the different parts of the heart have different blood supplies. So you can have narrowing in just one artery and it can cause a heart attack because that portion of the heart is not getting blood flow. It's not getting nutrients. It's not getting oxygen. So heart attack can happen even with blockage in just one artery or one blood vessel that's applying this oxygen, these nutrients. But sometimes people that have a heart attack in one artery because of that blockage might be more at risk of having blockages in other arteries. But in those arteries, it hasn't turned into a heart attack because there's still some flow. There's some flow that's going to those tissues and to those parts of the heart. So they might have narrowing of their arteries. As we talked about, narrowing of your arteries is coronary artery disease, while a heart attack is no flow at all. So it's completely blocked off. So when someone has a heart attack, they might have a complete blockage in just one artery or multiple arteries, but they don't necessarily have to have it in multiple. Does that answer your question, Gaina?
Yes.
Okay. Any other questions before we move on to the risk factors for heart disease and then how to prevent this, which I know is an important topic that we will cover today. So risk factors, I like to think about the risk factors as things that we can modify and things that we can't modify. So does anyone know a couple of things they think about that are risk factors for heart disease that you've heard about at all?
Smoking.
Smoking. Mm-hmm. And Sandra pointed out a great point in the chat. It's important to not have a friend take you to the hospital. You need to call 911 if you have symptoms of a heart attack, like that chest pressure we talked about, tingling in your arm and those symptoms. Any other risk factors you think about besides smoking that Gaina mentioned? Obesity, diabetes. Yep. So as I was saying, I like to think about it as things that are modifiable and things that are non-modifiable. So things that are non-modifiable are age. Age is a risk factor for heart disease. And that's something that you can't change. The other thing is family history. People who have family history of heart disease are more likely themselves to have heart disease. And sometimes this is a tricky question. What does family history mean? If someone in your family had a heart attack when they were 90, is that an important risk factor, or is it more if it's earlier? I like to think about it if there's a history of heart attack in your families in ages less than 55 or 60, that definitely puts you at a higher risk of heart attacks, especially earlier on in life. So that's an important thing to be aware of. So these two are the things that can't really be changed. You can't change your family history, you can't change your age, but things that you can focus on to how to prevent heart disease are some of the things that we all mentioned: smoking, obesity, hypertension or high blood pressure. So some things that we can change are high blood pressure. That's a big risk factor. So in blood pressure, those arteries are more likely to get blocked because they're under so much pressure. Similarly, other things are your cholesterol levels. Like we talked about, why does heart attack happen? Because there's all of these little gunky cholesterol particles that basically just stick into your arteries and make it harder for that blood and your oxygen and your nutrients to get to that heart muscle. And those cholesterol molecules affect that. And then another risk factor that someone mentioned is diabetes. This picture is trying to show someone, I guess, some sugar cubes and someone pricking their finger or checking their blood sugar. Another risk factor is not moving around a lot, having a very sedentary lifestyle where there's not much activity in your daily life. That can be a very big risk factor, as well as being overweight or obese. That can affect how your body metabolizes different types of particles and can lead to more plaque, or basically that gunky cholesterol things that we see in those arteries that are risk for heart attacks. And then smoking, someone mentioned that smoking is a big risk factor for heart disease, as well as alcohol. Now we're going to move on to how to prevent these. Someone asked a really good question in the chat, that some of these symptoms of heart disease or heart attacks are the same as panic attack symptoms. And that's a very important point, because sometimes it can be very difficult to figure out if someone has chest pain, is it related to their heart? Or is this related to panic attacks? Or is this related to heartburn or something that's wrong with just causing reflux after you eat, kind of those symptoms? But what's important is that if you have any of these symptoms, it's important to see your doctor. And if it's something that's very like severe chest pain, important to call 911 and come to the emergency department to make sure that this is not related to your heart. Does that answer kind of your comment, Jay Wiley?
Hi, sorry. I would be so embarrassed if I went all the way to the emergency room thinking I had a heart attack and they told me, "Oh, girl, you're just panicking."
Yeah, I think that's a very understandable concern. And I think it's important to recognize your own symptoms of panic attacks and then see if your symptoms are different. But it's also important to not dismiss yourself. And if it's something you're concerned about, call your primary care doctor right away, because they're very familiar with you and they can guide you to if they think that this is something that you need to go to the emergency department for. So I think your primary care doctor is very important in all of this.
I think it would be a shame to not go to the emergency room because you were worried it was just anxiety or a panic attack and then end up having a cardiac issue.
Definitely. Yeah. And I think a lot of times in women, heart attacks are missed more often because they can be attributed to other things. So it's very important to not take these symptoms lightly and go and seek that care, that you want to make sure that this is not your heart. We're going to move a little bit into prevention, right? We talked about those risk factors, but what can we do to prevent heart disease, to be able to make sure that the little plaque that builds up in your arteries doesn't build up and there's less of a chance of heart disease? What have you guys heard about how to prevent? it ties back a little bit into those risk factors we talked about. Definitely exercise, very important. Anything else besides exercise?
More, yeah, low fat.
Yep, low fat diet, healthy diet. Everyone's on spot on with their answers in the chat. Yeah, so some things to prevent these problems include, we talked about the risk factors of smoking, so trying to quit smoking, adopting a heart healthy eating plan. We'll talk a little bit about what that means. Managing stress is also very important. I think that's something we always sometimes forget. Day-to-day lives can be very stressful, and that can affect our heart as well as other parts of our body. I like Tony's comment, stress, what's that? And other things, as someone mentioned in chat, exercise, right? And that can be very difficult when there's a lot of, we're busy in our everyday lives, there's a lot of stress, but being able to, it doesn't have to necessarily be running on the treadmill or a really heavy workout. It can just be walking around your house. It doesn't even have to be outside, just getting steps in, keeping yourself physically mobile and not just sitting down is important. And then knowing your numbers, right? We talked about how some of those risk factors are high blood pressure, high cholesterol, high sugar, high diabetes. So knowing where you stand on all of those things and your lab tests when you see your primary care doctor is also really important. And then going off of those numbers, your weight is also an important number to keep in mind of, in terms of a healthy weight means a healthy heart. And then when we talk about a heart healthy eating plan, what do you guys think about that? What are foods that you associate with a heart healthy eating plan, things that will help your heart? And this can be things that you should eat and things that you shouldn't eat.
What about taking a baby aspirin?
That's a great question. I can't see you asked that, Sharada. I think it depends on what your risk factors are, as well as what type of, if you already have heart disease, sometimes you need to take medication. So the best thing about medications is to ask your primary care doctor, because they're the ones who know for sure what your risk factors are, as well as what your history is, because the answer really depends on if you've had a heart attack in the past, if it's known that you have plaque in your arteries. So the answer depends on that. Doesn't mean that if you don't know if you have heart disease that you should just take an aspirin to prevent it. Does that answer your question, Sharada?
It does.
Okay. Someone's great things being mentioned in the chat: dark leafy greens, fruits and vegetables we should eat, and things we shouldn't eat. Marilyn is mentioning fatty and fried foods. And Sandra is mentioning also some great points: eating whole grains, low carbs, low fat, and sodium. So when we think about foods for heart healthy diet, I think everything you guys are mentioning is spot on, very correct. And you can think about those cholesterol that we talked about, those good cholesterol, your HDLs are your good cholesterol. You want those to be high when your doctor checks those. And things that can help your good cholesterol are things like avocados, walnuts. And then the bad cholesterol is your LDL. Your LDL cholesterol, you want that to be lower. There's actually some foods that can help lower that, and that can include oatmeal, fruits, tofu. And then we talked a little bit about what we want to avoid. Marilyn mentioned fatty foods, fried foods. So all of these foods can increase that bad cholesterol, that LDL, and that can be found in fatty meats, especially egg yolks as well, and full fat dairy products like whole milk, as well as any processed snacks. A lot of times the processed food that's in supermarkets, we don't really know what's in it, and it can be really high in different types of fat. And then triglycerides are another type of bad cholesterol, and they can be things you want to avoid for triglycerides are drinking alcohol, simple carbohydrates or starches, meaning like white bread, things that are they're very processed, as well as animal products like red meat. And one way to prevent this is also adopting a plant-based diet or a vegetarian diet. A lot of vegetable products don't have that type of bad cholesterol, and it cuts out the meat. But I think it's important to remember that someone can be vegetarian, but also not have a heart healthy diet. You can be vegetarian and eat a lot of processed foods from the supermarket, eat a lot of fatty foods. You could be eating French fries and it can be vegetarian, but it can still have a lot of fat in it. So when you think about a heart healthy diet, it's important to avoid processed foods when you're thinking about it. And that can be a plant-based diet, but you also have to remember the processed aspect. So kind of the take-home points: cutting back on processed meats and saturated fats, drinking water instead of soda and juice as well. Soda and juice has a lot of sugar, it has a lot of processed things in it. So that's also important to avoid. And then avoiding trans fats. So what are trans fats? You can oftentimes, when you look at a nutrition label in the supermarket, it divides up that fat into different types. It says if it's saturated, it tells you if it's trans fats, and the things you want to avoid are saturated fats and trans fats. One way to think about that is there's good fats and bad fats. Some are worse than others, and trans are the worst. So that's something that you want to look at when you buy things in the supermarket, if you're looking at a nutrition label. Any questions about this? Has anyone ever looked at a nutrition label and thought about maybe seen trans fats, or have kind of had some experience shopping in the supermarket, looking at different things?
Are trans the solid fats like butter?
Yeah, so saturated fat is butter. One way to think about it is there's unsaturated fat, and that's usually liquid in room temperature, things like olive oil. And then saturated fats are usually solid in room temperature, so things like butter. That's correct. Any questions so far before we move on to the next part? Any questions about risk factors? Any questions about prevention?
I have a quick question.
Yeah.
Is there a difference between butter and margarine?
It's a good question. I personally don't know the difference in terms of which one is better or which one is not in terms of margarine or butter. My understanding is that both of them have saturated fat, which you want to avoid because they're usually kind of more solid in room temperature. So I don't know if one is better than the other.
Thank you.
Great question. Any other questions before we move on? So next we're going to talk about treatment. So it's important to prevent heart disease, but if you see your doctor and you have heart disease, it's also really important to follow treatment for this. And treatment can be different types. It could mean medications, but it could also mean other things. So what have you guys heard about? How is heart disease treated? Is it, when we think about medications and non-medications, what do you think about in non-medications? It comes back to the risk factors we talked about, right? Why does it form? Why does heart disease form? What it makes it more likely?
Stress reducing things like activities you like to do, meditation, yoga, taking a walk, or other, reading a book, things that help you reduce your stress.
Definitely. Yeah. I think meditation, yoga, a lot of these things are very important for stress, for sleep, for a lot of different things that really affect heart disease. Tony mentions a good point, bypass and other processes. So treatment can definitely involve procedures and surgeries depending on the level of heart disease. So I think treatment comes in lifestyle, similar to how you prevent it. If you have heart disease, you can follow the same kind of things that we talked about to prevent heart disease. Because if there's already heart disease, you want to make sure it doesn't get worse. And how do you do that? Same things we talked about and things that we just talked with Mandy about. Exercise, getting up and walking around the house, any level of exercise. And if you're not a big fan of walking or running, this can also mean doing stretches. It could just mean moving your body and getting active in whatever form that you enjoy. It's difficult to try to exercise every day if you don't like it and if you feel miserable. So it's nice to find ways that help you and things that you enjoy, that you find that something you can keep up to every day. And I often get asked, like, how much exercise is good? So usually what's recommended is at least 30 minutes of moderate intensity aerobic activity, which also includes walking, at least for 5 days per week. So that becomes a total of 150 minutes. And then the other thing we talked about a lot is what you're taking in, your vegetables, your fruits, trying to eat a heart healthy diet and eliminating those things that make your bad cholesterol worse. So these are all lifestyle modifications, and they're very similar no matter if you're preventing heart disease or if you're trying to treat it. And then the other thing is also really important to take your medications. If someone has heart disease, it's important to take medications. If they have high cholesterol, statin medications might be something that you've heard of that are very common. Medications to control blood pressure, medications to control diabetes, and some patients might need to be on blood thinners. This all depends on what type of heart disease you have, and that's why it's important to ask your doctor. And as Dr. Lau is mentioning in the chat, the guidelines don't recommend taking aspirin unless it's specifically directed by your doctor. So it's really important to ask your doctor before starting any medications. Any questions about everything we've talked about so far, about heart attacks, about artery disease?
Once you've been prescribed medication for cholesterol and blood pressure, can you ever get off of them?
That's a great question. Yeah. So Marilyn, it's a great question. So I think it depends on if you're taking these medications to prevent disease or if you already have heart disease. So if this is to prevent heart disease and you have high blood pressure and high cholesterol, you can get off those medications by also incorporating those lifestyle changes that we talked about. And this can be exercise, diet. So that doesn't mean that you have to take these medications for the rest of your life. However, if you already have had a heart attack, then sometimes these medications need to be taken for a longer period of time because it depends on if you had a procedure or if you had a certain treatment for your heart disease. And in that case, it's really important to follow what your doctor told you, as well as if you were in the hospital for a surgery or procedure after a heart attack, to continue taking those medications because it really helps prevent future heart attacks and future problems. Does that answer your question?
It does. And does taking baby aspirin also act as a preventive?
Yeah, so we talked about this a little bit earlier. So it's not recommended to take aspirin just to prevent heart disease because it can increase the risk of bleeding and other side effects. So it's very important to talk to your doctor about that. But sometimes if you've had a heart attack, it's important to continue taking the medications, which can include aspirin. But if you've never had a heart attack, you need to ask your doctor first before to make sure that that is something that is recommended for you, because it's not something automatically you should be taking every day just to prevent a heart attack. Does that make sense?
Yes.
Great question. I think that's a very commonly asked question, and aspirin has definitely made the news a lot of different times about recommendations and things like that. Very important. Any other questions before we move on? So we're just going to talk a little bit about the other types of things we talked about. Remember in the beginning, we were thinking that our heart is like a house. We just talked about all those blood pipes, all those pipes in the house, those blood vessels that bring oxygen and blood flow to our heart. And if they get cholesterol and little junk builds up, it can lead to a heart attack. And then we also talked about the muscle, right? The heart is a pump. It's a muscle that brings blood from one room to the other room and then sends it out to the rest of your body. So what can happen is that pump cannot work, and that's called heart failure. So heart failure is that your pump, it's like squeezing. It's squeezing and then relaxing, squeezing and then relaxing. And if your heart can't pump blood, then the blood is not going forward to all parts of your body and it's just sitting there in your heart. And that can be problematic. Has anyone ever heard about heart failure? Know someone who has heart failure? You can raise your hand as well. I see some people raising their hand. And what happens in heart failure is since your blood isn't moving forward, it's pulling back. So it's pulling back. So what happens when it pulls back is that it builds up. It needs to go somewhere and it can't go forward. So it goes backward and it builds up in your belly. You can have swelling in your belly, swelling in your legs. You can feel really, really short of breath because that blood is going into your lungs. And that can make you feel really tired, really lightheaded. You can't walk the same amount of distance you were walking. It can cause a change in weight. Everyone getting really, really having changes in their activity level. So those things happen when you have a problem with the pump. And Tony's asking a great question, is congestive heart failure different? So congestive heart failure is the same thing as what we're talking about when basically the heart isn't pumping and it's just getting very, very congested. It's just building up all of this blood that's pooling. And it can either be a problem of squeezing or a problem of relaxing. So a pump needs to squeeze and it needs to relax to send that blood forward. Any questions about this, about heart failure? There's no questions. We're going to move on to the next slide about rhythm problems. Like we talked about, the heart, just like a house has its electric panel, it needs energy, needs light. The heart needs to have that energy to squeeze, to act like the pump. And that energy is in this form of rhythm. You feel your heart beating. When your doctor listens to your heart with the stethoscope, they're hearing that beating. And that, if there's a problem with that beating, and if your heart's not getting that signal to pump and squeeze, that can be a problem. So usually your rhythm is one part of your heart tells your other part of your heart that now you need to squeeze. And if you have a lot of different parts of your heart telling to squeeze, your other rooms, basically the chambers, are going to get all confused. Do I listen to this or do I listen to the other? And it can be very irregular. Does anyone know what happens if you have this like irregular electrical signals, an irregular electric panel in your heart? Are there certain symptoms that you might feel, and what could that look like? Has anyone heard about this before?
So isn't this AFib that you're talking about? What they talk?
Yeah.
Okay. All right.
Yeah, absolutely correct. So Gain is mentioning something called atrial fibrillation, also known as AFib. And that's when your heart is not synchronized. One part isn't telling the other part to squeeze, but a lot of different parts. So it gets very irregular. And Sandra's mentioning a really good point as well, tachycardia, which basically means that your heart is beating really, really fast. It's going very rapidly. So rhythm problems can be different types. They can be tachycardia, she's mentioning, where it's going really, really fast, or it can go really, really slow, or it can just be irregular and be all kind of chaotic where the signal is coming from. And that's atrial fibrillation. And symptoms you can feel in this specific is feel palpitations or feel like your heart is racing or skipping a beat. And sometimes it can also feel like chest pain or feeling shortness of breath or feeling really, really tired. Or sometimes some people don't feel anything and they can be in something like atrial fibrillation. Any questions about the rhythm problems before we move on?
Yeah. So if your heart doesn't beat or can't beat enough beats per minute and you get a pacemaker, is that really electrical or is that heart failure? Because it seemed like how you were describing it, it seemed as though it could be like either. So which one is that? Is that really an electrical problem because you need a pacemaker to be able to beat faster than it needs to? Or is that heart failure where it is not pumping?
That's a great question. Usually when someone needs a pacemaker, it's because their heart is, the electrical problem is the problem, the rhythm, it's going too slow, or if it's going too fast, someone can have other type of pacemaker called a defibrillator, which is basically giving your heart a shock to make sure that it's going back into that same rhythm. What I was mentioning earlier about your heart not being able to pump is that sometimes if your heart is going really, really, really fast, it can make your muscle harder to squeeze, and you can have symptoms like heart failure. But usually when a pacemaker is put in, it's a problem with that rhythm, because that pacemaker is trying to make sure that it's a normal beat of your heart. It's not too fast, it's not too slow, that it's going in that normal type of rhythm that we want. Does that answer your question?
Yes.
Any follow-up questions?
I was kind of curious about the pacemaker. If like some person were to die, like does it, because it is just pacing, like does it keep pacing or does it automatically stop? And I don't know, that came to mind. I'm kind of like curious about it. I actually have a pacemaker. This is why I have all these other extra questions. So I was always curious about that. Like, what if you were supposed to die? Like, does it keep pacing?
Yeah.
Like, or does it automatically stop? It sounds a little bit morbid, but.
Yeah, so a pacemaker is the rhythm. And then sometimes people have a defibrillator, which is sometimes with the pacemaker, a pacemaker and a defibrillator. And the defibrillator basically gives the heart a shock that if you were to basically not have any rhythm, it tries to shock to try to bring the heart back into a regular rhythm. So it depends on what device you have. It can be very different
other one,
based. Not
the defibrillator.
Yeah.
So I just was curious as to, does that keep going or it doesn't?
The pacemaker usually tries to pace it, but if there's no rhythm at all, it can't, it's hard for it to it can't generate its own current. It still needs to have some current from somewhere.
Oh, okay. All right. Thank you.
Yeah, and that's a great question. Great segue into our next slide, actually, talking about cardiac arrest and heart attack. I think this is a question that I often see, and a lot of people have asked me, is a cardiac arrest the same thing as a heart attack? What do you guys think? What do you know, if these two things are different, or are these two things similar to each other? It's okay if you don't know as well. That's why we're going to go over this. Gain, I see that you're unmuted. Do you know the difference, or do you?
I actually don't know. I'm very curious as to your answer, because I never really thought about the difference between a cardiac arrest and a heart attack. So I'm very curious about your answer, because I honestly don't know what the difference is.
Yeah, so in a cardiac arrest is a problem with the rhythm, while a heart attack is a problem with the plumbing, right? We talked about the house. A house has its pipes, the plumbing, and then it has its electrical panel. Similarly, remember we talked about the heart has its electrical system, the rhythm that tells it to beat. And in the heart, it also has the blood vessels or the pipes that give it oxygen and nutrients. So what happens in a cardiac arrest is that there's no electrical system, there's no beating, the heart is not beating. And this can happen very suddenly. And this causes no pulse because the heart is not beating at all. While a heart attack affects the plumbing of the heart, the blood vessels of the heart. And that when that happens, there's no blood flow, there's no oxygen and nutrients going to part of the heart. So that tissue of the heart, that part of the heart dies. And that's a heart attack. But the pulse is still going on, the heart is still beating. The electrical system, the electrical panel is still working. Does that make sense? Is that helpful? I see some nods.
If a part dies, you said the part of the heart dies, so that can never be like regenerated or anything, like that's it, that part of the heart is always dead? Is that what you're saying?
That's a very good question. It depends on kind of how big the heart attack was. Sometimes if the heart attack is really big, one portion of it might not have gotten any oxygen, not gotten any nutrients for a long time. So that small portion that tissue is basically dead. It won't have the ability to come back. But the rest of your heart is still squeezing and pumping and working. So it's okay, but your heart might be squeezing less. And when we said the heart is squeezing less, the muscle, that can cause heart failure. It depends on how big or small the heart attack is. Great questions. We're gonna just talk a little bit about what to expect if you have some sort of study for heart disease. There's a lot of different tests that people might need to do. And these can be if you have heart disease, or it can just be something that you get done normally at your doctor's office. So the first thing is an EKG. Has anyone ever had an EKG done? How does that work? How long does it take? What does it feel like?
Can I just jump in?
Yeah, definitely.
So if I'm not mistaken, I think I had an EKG, and they put a bunch of little things on my torso, and it didn't take long at all.
Yeah, you're absolutely correct. So what happens in EKG is they put these little things called electrodes. They're basically just really, really sticky stickers in different parts of your chest. And these tell the computer how your heart rhythm looks like, how your heart is beating. And it usually doesn't take that long. They put it on you and it goes up onto the monitor. So this is a very, very quick test, and very commonly can be done in your doctor's office, in your primary care doctor's office. And as Tony said, it's very quick and painless. And your doctor can take a look at that and see how your heart is beating in terms of the rhythm and other things. And then another part of test that is related to heart disease is a stress test. Has anyone ever had a stress test or heard about a stress test? This is not as commonly done as an EKG. An EKG might be done at your doctor's office. On a treadmill, great, Tony. So you might be asked to walk on a treadmill, and then they attach those electrodes, those EKG electrodes, to get a sense of how your heart is working when you're exercising, when you're stressing your muscle and stressing your heart. And that can give information of how your heart is doing under stress. And some types of stress tests are not, if someone can't run on the treadmill, they can still get a stress test in which they just put a medication in your arm and it causes stress to your heart, so that in the machine, in the CT scan or MRI machine, you can get a sense of how your heart function is like. And this test takes a little bit longer. This test, in which you're not exercising on a treadmill, can take a couple of hours when they put that medication and then take those scans. Any questions before we move on to the last couple of studies and then wrap up? The next one I want to talk about is an echocardiogram, or an echo, which is also sometimes it's actually probably more common to have than a stress test. Does anyone know what that is?
Yeah, I've had several echoes done. They're doing them pretty often. It's pretty painless.
Yeah, definitely. It's definitely not painful. At times it can be if the probe is really hard on you. Basically what happens in an echocardiogram is it's an ultrasound. So they put some gel on your chest, and that gel helps get signal to the computer so we can see how your heart looks like inside, how the chambers, the rooms of the house, how those are squeezing, how the little doorways or the valves, how those are looking like. So it can take between 30 minutes to an hour to have a full view. Any questions about the studies that we've talked about or anything so far? Basically gives a picture, a little window into the heart. And then there's another type of heart study that can both be diagnostic, it can give information, or it can be actually a treatment option in certain situations of heart disease. Has anyone ever heard about an angiogram or a cath or an angioplasty? There's different names that you might have heard this of, or even stents, kind of these names. Any of these sound familiar? I see some nods from Jackie and Mandy and a couple other people. Heard of stents, yeah. So what happens in a cath or an angiogram is that this is an invasive test that looks at your blood vessels from the inside. So it's not a full surgery. It's a small wire is put into a vein in your leg, or more commonly nowadays in your wrist. And that wire goes into your heart, and it can see the blood vessels. It can see that blockages, if there's any blockages in the blood vessels. So it can give a picture of how your heart looks like from the inside, as well as if there's a heart attack, it can place a stent to open up that vessel that's completely closed, that pipe. Remember that pipe in the house, that pipe in the heart, if that is closed up, it can also try to open that back up. Any questions about that, or anything we've talked about? I think we just have one more slide left, and then we'll open it up to questions as well at the end. So I think this brings it back to kind of wrap it up in terms of take-home points, in terms of how to address heart disease and how to prevent it and treat it. And it's important to address upstream factors of heart disease. We talked a lot about exercise and diet and things that we can do to prevent it as well as to treat it. So it comes back to some of the presentations you heard about in the last couple of months in the Sportsmen's as well, with I think Luisa talking about, Dr. Paredes talking about high blood pressure, and another one of my colleagues talking about high blood sugars or diabetes. So addressing high blood pressure or hypertension, addressing being overweight or obese, diabetes or high cholesterol, it's important for these 4 things to be managed well to prevent heart disease and to also treat heart disease. And some of these upstream factors, there's different proportions of these in different communities and different populations. And this graph just shows that non-Hispanic Black adults that are 20 or over were more likely to have high blood pressure. And this is also, there's differences also in diabetes and other types of heart disease. So it's important to address these upstream factors as well as the different causes of this. Any questions so far about these upstream factors, the high blood pressure, cholesterol, diabetes? I know we went through a lot of different types of heart disease, but just it comes back to the house. It's your heart is a pump. It's trying to bring oxygen and blood flow and nutrients to all part of your body, and what's important to help your heart squeeze well and for it to get good nutrients and supply is to take care of your diet and exercise, as well as these risk factors that we talked about.